how long is the recovery from the pudendal nerve decompression surgery, and does the pudendal nerve entrapment ever return? So it is really difficult to talk about the recovery from the pudendal nerve surgery because it really depends what do you call a recovery. Is it a recovery to walk? Is it the recovery to be able to sit? Is it a recovery to be able to go back to work, or is it the recovery to be able to do sports or have sexual activity? And again, if it's the recovery to go back to work, it very much depends what work do you do. If you have a desk job, especially if you can have a standing desk, then you pretty much can return to work when your pain is low enough for you to be able to stand at work. But if you are a construction worker, if you are an Amazon delivery person and you're lifting heavy boxes, then your return to work will be, of course, prolonged. So it very much depends on what do you do and what do you mean by recovery. As mentioned in previous videos, most of my patients are able to walk the same day after surgery, and then I allow my patients to do anything that their body allows them to do, meaning you have no limitations except for one. You cannot flex your hip over 90 degrees because you have a repaired sacrotuberous ligament. So for me, in order to get to the pudendal nerve, I have to cut this ligament in order to get to the area where the pudendal nerve runs. And then the ligament is repaired, and that ligament has to heal. And that ligament will take 6 months to heal. So I ask you not to take 2 steps at the time. I ask you not to squat. I ask you not to go mountain climbing. Although I've had patients who a few weeks after surgery went mountain climbing. I believe that because I use the pain pump after surgery, so I implant the pump that drips the local anesthetic on the pudendal nerve, that helps control the central sensitization, which is the memory of pain in the central nervous system. And I believe that patients that have the pain pump recover faster because you are addressing the central part of the nerve. As far as I know, some other surgeons performing the surgery do not implant the pain pump. And the second part of the question is, does the pudendal nerve entrapment come back? Yes, like with any surgery, the scarring may happen after surgery. Some patients have more tendency to form scar than the others. I recently talked to a patient who 22 years ago had surgery by my mentor, Professor Roger Robert, in Nantes, France. And he was pain-free for 22 years. And his pain recently returned. So the question is his pain because of the muscle spasm, or is his pain caused by the scarring of the nerve? I don't know that yet. I only saw a patient on telehealth. I was not able to examine him, and I did refer him to a physical therapist near him to assess his muscles first. There are certain things that you can do to decrease the risk of the rescarring of the nerve, and I do those during the surgery. I wrap the nerve with different kinds of wraps that decrease the risk of nerve rescarring. The one that I'm currently using is the wrap which is made of the amniotic membrane, which is the membrane in which fetus grows during pregnancy. Those are obtained from cesarean sections, and they are screened, of course, for all the viruses and all the bad things that they may contain. And once the membrane passes the test, then I do wrap the pudendal nerve with the amniotic membrane. The amniotic membrane not only serves as an anti-adhesive barrier, which means it decreases the risk of rescarring of the nerve, but it also contains the growth factors which promote the nerve healing, and they have all the anti-inflammatory factors that decrease the inflammation around the nerve. Thank you.